According to therapists, for every suicide, there are over 20 attempts by the victim that often go unchecked. In Uganda, attempting suicide is criminal, and reasons behind youth suicide are complex.
Suicide is a global problem. Over 1 million people die from committing suicide, which is bigger than war, HIV/AIDS, and it is the second largest cause of death in the age group of 15 to 29. So it's a huge issue.
Recently, there have been random cases of suicide in schools, and the silence surrounding mental health is continuing to exacerbate suicidal ideation among youths, as it prevents many from seeking the help they desperately need. Health Ministry officials say there is currently no conclusive data on mental health to guide policy makers.
We've not had a prevalence study. We've not done a study that measures how many people out there are actually suffering. This puts us in a situation whereby we only will treat people as they come in. Sometimes they come in 7, sometimes 10, sometimes 30, sometimes even a very big number. So you can imagine, and most times they come in when it's severe. So you can imagine a facility which has not prepared for the certain numbers. You know, we are just thinking sometimes we overestimate or underestimate.
Dr. Hasfa Lukwata, the Acting Assistant Commissioner for Mental Health and Substance Abuse Control at the Ministry of Health, says that of the certified 60 psychiatrists across the country, only 17 have been deployed due to budget constraints.
We do not have the psychologists or the people who are supposed to offer this kind of service in most of our facilities. I think we only have the clinical psychologists in just a few of the regional referral hospitals, I think just 2 of them. And then, of course, the majority are now in Otabika Hospital. That puts the rest of the community or the rest of the country in a very tight situation.
Meanwhile, the ministry, together with some non-government organizations, has rolled out capacity building programs for medical workers to bridge the gaps.
So we're trying to work with the Ministry of Education and Sports, and we've agreed that there should be a counsellor. We are trying to advocate for counsellors to be in schools, but in an event that this cannot be, let's train more than 3 people on the school team. We are looking out for the senior man, senior woman, and the sick bay. If it's a nurse or whatever cadre of health facility is there at the sick bay, these people should be able. We are teaching them on how to offer psychological first aid.
To be able to detect that a member of staff is quiet, is withdrawn, seems depressed, doesn't seem to be talking. How do we deal with that? We skill them, we train them so that they're able to address these problems in the workplace and where all of us go and spend most of our time. So a national suicide prevention policy is necessary.
According to the World Health Organization, suicide is a major public health challenge, claiming over 720,000 people annually. Juliet Naloga, NTV.